My name is Nara Murillo. I'm the host of Agewell Avenue podcast, and my co-host is Barbara Slingloff.
On this show, we talk about navigating healthcare, housing, investing, and advocating for our seniors.
In our last podcast, Nara, you were sharing about your work experience, and we left off with you sharing about Cedars-Sinai. Why don't you share about what happened after you left Cedars-Sinai?
Yeah, so after that, it was actually interesting and exciting all at the same time because I actually had an opportunity to work with you again. And it was I got an opportunity to be in leadership. So I was actually I ended up taking on a role as a supervisor in the in the UM department, utilization management department at St. John, at the time of St. Joseph's. And then obviously Providence bought, or they merged, I should say. And so it was, it was an exciting opportunity. Of course, it was a lot of new things for me again to learn. And, it really gave me an opportunity to decide on what type of leader I wanted to be, right? And because I always knew I was at that point where, I could do more because I had learned so much already, being in doing this, for quite some time already at this point. So for me, it was really about what is next for me. And I wanted to be able to, because throughout my career, I was training a lot of people. I was, educating and what I knew, and I knew I had a lot of knowledge, but it's very different when you're a leader because it just takes a different type of understanding, a different type of skill set. And so I think that it was exciting for me. And at the time when I joined the team, there was obviously the department had 100 employees at the time, and I think it was kind of wow. It was like eye opening. I go from like no experience to having 100 people, to kind of oversee, and obviously you have your direct reports, but having 100 people to kind of oversee is still a lot of people. And so I think we had two managers and two supervisors. Obviously, I had a partner that was, managing the team as well with me. I think at the time we were managing non-HMO, and I specifically was managing the non-HMO team. And then I had 35 direct reports that were reporting to me directly. And so, and I also had my own review, right? So I had to still review myself on top of, all of my other duties and role that I had, for leadership. So, but, obviously just managing those people, scheduling one-on-ones, and, going through team meetings every morning, and, just addressing issues with the team real time. I would always let them know, tell me what issues you came up with, or what you had, and I can either address it or direct you in the right direction. But at the same time, I would always let them know, bring things to me in real time, because if I don't know it, I can't assist. And if something comes to me after the fact, then it's harder to address it than in real time. So so I kind of taught the team to be able to come to me having an open door policy for them to, just bring me the things that they needed addressed. So it was just, I think, a good, I had a good relationship with all of my employees, all of my direct reports. So, and they knew me. So it was a really good collaboration between all of us in running the team smoothly. And then, of course, I would approve all the PTOs and approve time cards and doing performance evaluations, and talk to them about growth, talk to them about improvements, and I wanted to always be supportive of, you know, what they wanted to do, if they wanted to grow, how I could help them grow. And I think that I have to I have to say this because it's the truth. I think as you and I had worked together, and me reporting to you, I always watched how you did things, and I always learned from how you handled things. And I remember going into meetings and sitting in meetings and watching how you would communicate with people, and how you did not really say a whole lot in meetings, but what you said, people were listening. And so to me, that was very important. And to understand, right? Where, how do you run a meeting, and how to be able to elaborate what's really important and what's really, needing addressing, right? So, and also utilizing the time of the meeting appropriately, you know? So those are some of the things that really stood out for me. So, but I think a lot of it, I have to give you credit where credit is due. Like a lot of what I know today, has been taught from you. Like you've taught me, I've learned from you. So do you have anything to
We
add?
listening is really a skill, and um, people hear things, but listening is something different. And listening um, is something that we have to practice. And I think meetings become more fruitful when we become good listeners. So that listening skill really benefits you. So maybe you don't have to say as much because you're taking in everything and you're really listening, so that when you are sharing your thoughts and ideas, to your point, you feel like people are really now hearing this, because I can collectively take everything that I've heard, process, and then offer insight that hopefully is meaningful. And it works the same when you're having one on ones or your direct reports. I think when you work for large corporations, it's much harder. Um, it, People don't feel as heard sometimes. And when you have leadership that does hear you, um, I think you've heard me say before too that if you ask someone who is your best teacher or worst teacher, without hesitation, people have an answer to both of those questions. Those people stay with us a long time, but that's also true of the people that we work for. If you ask someone, if someone stands out, or someone's leadership that was much more difficult for you, I think those things stay with us a long time. So when you talked about just a few minutes ago, I think what's really important, what you said was getting the opportunity to decide about what kind of leader you wanted to be. That this was your opportunity to design, create, um, adjust, and grow in how you pictured it and what it was that you were trying to accomplish, and the kind of impact you were going to leave, not just in healthcare, but with the people that you were supporting.
Yeah, absolutely. And I think that, we've spoken about this many times about us training people. And when we're training people, we're not going to be doing this for a long time, right? So I remember us interviewing people, as we obviously were a big department, and we had people come, people go, and we used to, interview a lot of different role for a lot of different roles and positions. So I think that I remember um, us choosing people that can actually, I remember this so well. It was yesterday, passing on the baton, right? Is that we're not going to be doing this for a long period of time. So
Mhm.
who can we find that is receptive to what we're trying to bring and what we're trying to do and what we're trying to accomplish? And having those same goals and having those same vision, right? Because you and I both know, being in this space, being in leadership, we've seen very different leaders, right? Very different styles. So having someone aligning with how you manage and how you lead is is huge, right? And not everybody thinks that way. A lot of different people have different agendas, right? So as leaders, you take on this role as, what is it about you as a leader that makes you different, and that, people, and obviously being, having 100 people, not everybody was, I would always say I'm not everybody's cup of tea, but that's okay, because I love the way I am as a person, and I wouldn't have it any other way. And I know what I want and where I'm going. And whoever that I'm going to lead is going to be on the same page as me. And that's all that's important, because not everybody's going to be agreeing to the style that you lead, and this and the leadership that you lead. So I think that it was just an eye opener for me, and just seeing, right, how different places and different people lead. And I was so comfortable in what I had learned from you, that this is where I wanted to be, and this is the type of leader I wanted to be. So I think finding that was really, really important for me. So
I think mentoring people and asking them about where they see themselves, or if they're wanting growth opportunities. We had, because we had such a large group, there were people who really voiced um, their desire to be in leadership. And we would always ask, tell us why. Because some people can have a thought about leadership having never been in it and what it looks like to them. And part of what they share about leadership is they're holding up a mirror to what they have been exposed to and what their perception is of leadership. And sometimes people think being in leadership means you get to tell people what to do, and that you'll have this power that you can exercise. And for us, um, I know we've talked about servant leadership and what it means to serve the people um, that we basically worked for. We worked for the employees. And so when people would share that their idea about leadership looked like um, telling people what to do or having some power in some way, um, one of the things I think is important that we shared with them was about the responsibility, that there is a responsibility that you have to people who you are leading, and you have to understand and know why you're doing it. And leadership is not for everyone. It's not supposed to be for everyone. But again, if you look at the word leadership and you see the word lead, you're inviting people to follow. You're not forcing them. And um, I think that not everyone has the same leadership style, like you mentioned before. And there's many ways to get to the same place. And finding what works for you and what's comfortable for you, which I think is what you did, and just feeling good about how you did that was important, and the impact that you can have, not just with the patients, but again with the people that you get the opportunity to mentor and support.
no, absolutely. And I think that as we went through some of the leadership changes, in ourselves, right, with the merge and everything else, and we had obviously restructuring ourselves, and there was process improvements that they were trying to implement. And as our leaders left, and we obviously received new leadership, um, we had a lot of different things implemented. And I remember us having meetings with them and with HR, and going through all the different, you know, own it and the values, right, that we had. And, it's going through, I think that if I remember, we were going through some management training as well. And I remember being in management training, and I remember saying, okay, I already do this. I already know this. What am I taking this for? You know what I mean? Because I was just thinking, okay, there isn't anything that I don't know or I'm not doing already. So to me, it was just almost, in a way, was validating that this is what we were being taught. But I was also thinking, I know a lot. Why are we going through this if we're not going to follow that? Right? Because I knew there was a lot of leaders that did not follow those things. Right. And so, and of course, you have some people that like your style, and then there are some people that don't. We were very much about, I remember talking to my own employees, and I would tell them I knew their work, number one, everything that they were doing, I knew their job. So for me to have an expectation from them, I knew what I was expecting from them because I had done their work. And I would always tell them that, I'm not asking you for something that I haven't already done, that I know can be done, right? And so, and I had learned so much from you as far as, okay, how do we figure out how many bodies do we need to be doing this work, right? And we used to do time studies on, okay, from beginning to end, what does this process take? So we would look at that, and then we would try to improve it, or we would say, I think we do need additional help, or however that we went about that. But ultimately, I remember us doing those things, and it made sense for me. I was like, this is how you do things. And I think that it was such a big growth for me. I think and I don't know if you saw that, from the beginning when I came. Obviously I didn't have a lot of leadership experience, but I've trained people, I had led people. So it was kind of like, it's very different. It's a very different role. And I don't know if you noticed that throughout the time, that as I was growing and as I was learning, I was adjusting too, because dealing with 100 different employees when you're doing evaluations, performance evaluations, and talking to them about certain things, how to deliver the information, because not everybody takes on information the same way, right? And adjusting. And I think all of that skill, some of it came for me from my case management side, because I had to bring these people on board to go along for the ride with me, right? So it was the same situation. Now I'm trying to deliver information that might be hard, but how do I deliver that information for it not to feel that hard, right? So I think that that's a skill on its own. So it's to me, I think it was just really kind of flexing that muscle and kind of trying to almost adjust to this type of environment now, right? It's like, how do I deliver this information so it's not really hurtful, but I'm also delivering that information for them to know where I stand and what my expectations are, and just knowing that what they were capable of, right? And so just kind of empowering them as well, in many ways. So I think that some of that was really, really kind of eye opening for me, and I learned so much from that. But I just remember there was just so much that we were doing at the time, going through, IPA network management meetings, and, just our like surveys that we would go through. I mean, I remember we were thinking, who's saying these things? Like, who is saying that they're not getting enough, or you know what I mean? So it was just so mind boggling for me, and I don't know if you want to add to that, but
I think just for some context, um, you mentioned something called Own It, and it was really part of the culture that the company was creating. Um, at that time, prior to Providence merging with St. Joseph's, there was a lot of longevity. People had been with the company a very long time. And so when you have employees who feel very loyal, and then you have change on top of that, they have a lot of strong feelings. And so prior to the merging, um, companies were starting to create regionalization for departments and moving people, and that's how the department got to be the size that it was. Moving every IPA group and medical group, department all together in one space. And so that became a challenge in and of itself. And then on top of that, a merger happens, and then things continue to change. So people who have longevity, who've been able to count on a certain behavior, on a certain way of doing things, and now you turn that upside down and shake it, people do have strong feelings. So on top of that, you mentioned employees were given surveys to fill out about how they felt about their work, about their leaders, about the things they didn't like. And so the surveys were very telling. And so we would meet with the employees and ask for their feedback about what did that mean to them. Some of the questions meant different things to different people, but the desire to improve and hit the marks on some of those things, it required better understanding as to how people were feeling. And then again, in some companies and some cultures, people feel fearful to speak up or to share how they actually are feeling because they feel like there's going to be some repercussion. But what I can say with confidence is when we worked there, it was really a desire to do better and to deliver. It was our place, meaning everyone's place. And if that workspace didn't feel right, or if there were things that we could do to do better, let's do that. But then sometimes, again, when you have people with a lot of years and they just don't like change, sometimes things just have to change. But how can we be supportive? They may not like it, but we have to give them a space to say they don't like it. And how can we help them through that rough time? And I think we did try to do that with the leadership style, and it's always a growth opportunity for any leader, no matter how long you've been in leadership. The employees are there to help us grow as much as we're there to help the employees grow, because in dealing with people in general, we're all teaching each other something in the end.
Absolutely. Yeah, I agree. And I think we were just even learning from the staff meetings, right? Just how everybody would interact, and we would watch, right? How everybody, and I mean, I think that's what makes us all different and unique, because we come from so many different backgrounds, and just learning and understanding, and also adjusting to, this person doesn't know any better because they haven't seen it, right? And obviously, as we would work, we would find out more about them, right? The employees would actually share, things with us as well. Um, but just learning all the different styles of how to approach an employee, and how to, I mean, you and I both know, we had to speak to them in regards to certain behavior and disciplinary actions and things like that. So just following the process and understanding how it works. And um, it was just a huge learning curve for me, and I just loved it. I loved it. I loved every minute of it, because I think that it just made me a stronger, not only a leader, but as an individual, right? And as we learn, we teach our children as well, right? So we want to be putting out good human beings in this world. So the more we know, the better we're equipped to handle certain situations, and to lead, and to grow, and however that looks, and wherever we're headed, and whatever we're trying to impact, it just equips us better, as we have those skills, right? So, but I think just we had there's just so much going on there. I remember us having the employee engagement committee, right, doing the activities, and we had the team, and it was always just celebrations, right, whether it was Christmas or Valentine's Day, and just the employees. It was something not huge, even, right, even if it was something small, but they would just appreciate it. that we even thought about them and that we did that for them. And so I think just recognizing even just a little bit, the small recognition that we gave to people, it was just a huge appreciation for them that we thought of them. And I think that just the little things, and I remember you doing this even at PAH. I remember you doing this. It was always just recognizing them, and you were always so giving. And so I just always appreciated that, and just I felt blessed that I was able to learn from you and what I was able to do and move in life and impact. And the time that I met you was just a very pivotal moment in my life where I was kind of building on to what my life was going to be and what my purpose was, And so, and I couldn't have asked for a better teacher and for me to look up to and grow and become who I am today. But just going through these experiences and um, meeting with the medical directors and, having conversations where these physicians felt that we helped them in their own role, right? We supported them. So the appreciation between and the collaboration that we had with them, I think was, and just learning, more learning from them and how they moved. And every physician is different, has a different style, and so kind of understanding and maneuvering in that as well, and them feeling comfortable that they can come to you for anything. I think that was huge for me to learn, and collaborate with them as well. I think maybe in my whole entire career, I might have had maybe one physician that I just didn't see an eye to eye with, but eventually it turned around, because I'm not one to back down. We all know that. Or afraid to speak my mind. I just think that when you know me well about this. If I know about something, I will fight it until the end. But if I'm not sure about something, I'm not going to argue or fight. I will always stand aside and say, "Let me find out and get back to you on that." But if I know something, then I will fight it until the end. And I think that's how it should be. I think that one of the biggest things also that I learned with dealing with a lot of our employees was having their back, so to say, right? Because them really feeling that they had the support, that we were their voice. Because even though they had the surveys but in the day to day, knowing that that support was there for them, I would have done anything as a leader because that was my job. That's why I was there, to make that impact for them, to be their voice, to speak for them, and to always have support and provide support for them. So I think that that was one of the biggest things that fulfilled me as a leader, because I knew our employees were happy.
And for some context there, um, for those who know about utilization management or the utilization management department, it's not one of the more well liked departments because with managed care come these referrals, and people have to wait for a referral. And anytime we're waiting for care, that can be troublesome. It can cause more angst. It can cause people to feel more fearful, and rightfully so if you're waiting for a biopsy, if you're waiting for chemotherapy, if you're waiting for something. So here at, at this location at St. Joseph's, we were processing about between 40 and 50,000 referrals a month. So that was a huge responsibility, and that was a lot of care, and that was a lot of people waiting. And so because our department, most people were waiting on us, our employees would take some heat, and so would we. But to Nara's point, when people feel like they have the support of the leadership, and while our department wasn't perfect, we worked very hard to make improvements in order for patients to get care as quickly as possible, because that's really the ideal piece. And we would always say, referrals are not paper, these are people. And so if people were standing outside someone's cubicle waiting, you know, that's with the urgency in which we need to work and move. Is if there's a line waiting outside, waiting for you, waiting on you. And I think that's how we led. But in leadership in general, employees are looking to be trusted, valued, respected, and appreciated. And I think those core things, no matter what work you do, are the things that employees are really looking for in their workplace and in their leadership. And we worked hard to try to provide that for them. And I think when you say you have their back and they feel supported, that goes a long way with them. And I saw so much growth in our first opportunity to work together at PIH to St. Joseph's. And there was tremendous growth. And again, when you open yourself up to learning, look what happens, right?
Absolutely. Yeah. No, and I think that you were given plenty of opportunity to people. And I think it was really just about whether you took those opportunities or you didn't. Every step of the way, you would always give people opportunities. And I think that the way I knew that a lot of the employees were happy in the space that we were in was when we needed, sometimes our referrals, because obviously we had turnaround times and, timelines that we had to meet. And we would ask them for them to stay overtime. And a lot of them had families, and they were always, always happy to stay, happy to work. I remember us putting long hours here as well, but they were happy to do it. And that's when I recognized that, what we were doing was good and it was the right thing to do, whatever that was. Even though I think that we were getting a lot of pushback as well, as we were changing things and, going through some of the improvements and things like that, obviously, when you're reporting with someone, to someone higher, it's a very different type of situation. It's not us dealing with our employees, but they look at it as a different level and from a different lens, I would say, right? And even though sometimes it doesn't have to be, but this is just, again, right, the type of leaders they are. So I think that that's really where a lot of that was just so fulfilling for me, that I knew that they were happy to be with us under our leadership. And it was just a great feeling all the way around. But just, I remember having meetings with HR and going through, this whole transition. And I remember us having meetings with our vendors, the DME vendors, home health vendors, right? I remember when we had a vendor that was going after, we're not going to name names, but I remember that they were collecting copays from the patients, and you said, we're not going to have this, and we're not going to be giving you a lot of business at this point if you don't correct your processes. So I remember that conversation, and that turned around very quickly. So I was very, very happy and impressed about that. But this is where we go back to, if there is a will, there is a way. There's always a way to get what you need for the benefit or for the bettering of our patient experience. And we were going to be doing whatever it took to make sure that happened, because if it wasn't this vendor, it was going to be another vendor that provided the same exact product, right? So it was really about giving our patients the best possible experience that they could have. And we were going to do whatever it took. And also making it for our employees, right? It's easier on our employees as well.
think throughout the course of our opportunities to work together, um, what has been super clear for the both of us is, one, we all are going to be patients if we haven't already been patients, and someone we care more about than anything in this world has been a patient, and maybe they haven't been taken care of the way you had hoped. Maybe you've been disappointed in the care. Um, maybe somebody dropped the ball. But what we've always tried to do is say, I want all of our patients and our members to be taken care of just like I would want my parents or my grandparents. I want the same thing for them as I would want for my own family. And so that was the driver in, is it the right thing to do? Um, and we don't begrudge anybody to be making money at a business. But if we're all going to be patients one day, who wants to volunteer to be the patient where the ball is dropped, or while you're sick and hurt, someone's asking you for money and you can't get what you need until you pay? No one wants that. That is not, you have to know the time and the place. And so we did advocate hard for the care of and the treatment of the patients across the board as if they were our family.
Absolutely. Absolutely. That's the only way I do it. That is the only way. I've said it many times. I tell people all the time when I talk to them too, if this was my family, this is what I would have done. But again, it's always their choice and what they decide to do. But at least that they know that as a professional being in this field, that I look at them just like family. Then, I don't, to me, there's no difference. A patient is a patient to me, And so, and as you said, in this space, there's plenty of money to be made, but it's always doing the right thing, because at night, when I go to bed, I want to feel good about the change I made, the impact I made in people's lives. And that's what helps me sleep good at nights. And obviously there's other things that keeps me up, but we'll go into we'll go into that in other episodes. But it's just one of those things that really I take very personal, and it's a very important and a huge thing for me. But I remember us having pharmacy in house. We had our own pharmacy, that we would get a lot of our medications through them. And even though we would approve them and authorize them, we would review for them. But we did have our own pharmacy, which was nice to have, us being able to have a conversation if there was an issue or a concern, making sure that the patient received their medications on time and promptly. So that was always great. And then obviously handling patient complaints, and physician complaints, of course. We were the first ones to hear about them. If something wasn't working and if something was taking too long, then we would hear about that. And then we had to go back back to the drawing board. Let's do this again and see how we can improve this process. But sometimes there's just only so much you can do based on what you have, based on systems, even, right? If you don't have the right systems, you're only able to accomplish so much. And I remember us partnering up with the call center. How can we improve the patient experience? How can we make things a lot smoother, where people didn't have to wait and had answers to their questions right away? And there was no delays in anything or information or whatever that they were looking for. And so I remember us doing that. And then, of course, I remember having a outside company come and give us. I remember going through. They interviewed us and going through how to improve our processes and how to improve our systems. And so I think that was definitely an interesting experience. And a lot of times, I've experienced this a couple of times within, some of the companies I've worked with. or 4, they bring outside consulting agencies and things like that for, for improvement purposes or whatever. And I know it costs a ridiculous amount of money. And I just wish that they would just hear us who do the work tell them that. You want to add anything about that?
Sometimes the answer's in our backyard. And I agree with you. And consulting firms work hard at having people who are at the top of their game for very specific things. But I think we all can agree that finding ways to fix things, that's half the battle. The other half is probably the hardest, which is the implementation of that, especially when you work at a large organization. So those vendors are extremely helpful, but we also know that moving something from point A to point B, from paper to actual action, that can take a lot longer and can be much more tangled. And so, but I agree. I think sometimes the answer is in the backyard. And so I think we'll leave it there.
Yeah, no, sounds good. And then I think we just started like developing processes for Northern California for us to be processing referrals for them. And then I think after that, I think we both kind of, when, I went someplace else, and then I think you went someplace else after that, between leadership changes and things like that. I think that was another one of the other reasons where, we go where we align ourselves with the goals of each organization. And this time around was another situation where the changes and the goals weren't really aligning with where we were headed and the direction we were going. And so, and that's when we decided to depart. But I think it was a great time, and it was a great experience learning wise and just all the way around. And I think that the most important lesson, or the most important takeaway from this episode, is really about, when you're a leader, that is so important to have the right values, to lead people the right way. And I think that I can't say this enough, because if you want a successful business, you have to be the right leader, because you will not have a successful business, as we all know, going through all these different organizations, and we hear how much money is being lost. And many times we saw ourselves firsthand how much money there was being lost. But nobody seemed to really hear when we would bring it up to the table, or when we would bring it to people's attentions, right? A lot of times they would just be dismissed. And I think that you always listen to the people that are doing the work firsthand. But some of these organizations, because they're so big, right? And it just trickles down from the top. And so the top doesn't know what the people firsthand working these things are doing. And I think that's our biggest issue, is understanding what your each employee's role is and how they impact and how that works. And until you understand those things, you will not have a successful business. To me, that's what I have taken throughout my years in this space. That's what I learned and saw firsthand. So be intentional about the type of leader that you want to be. That is my takeaway from whoever's listening to this episode. The most fun way to watch us is on YouTube, so be sure to like and subscribe. Also, you can follow me on Instagram, Facebook, LinkedIn, and listen on Apple and Spotify as well. If you would like to learn more about a specific topic, please reach out to us by email. You can find all this information below in the show notes.